A chronic glaucoma is a chronic anterior optic neuropathy, often asymptomatic in its early stages, generally associated with ocular hypertension, meaning elevated intraocular pressure caused by a decreased drainage of aqueous humor, the clear fluid that fills the eye and normally circulates and drains through the iridocorneal angle. When this drainage is impaired, pressure can build up inside the eye, gradually damaging the optic nerve. Chronic glaucoma is characterized by four key signs. Glaucomatous excavation, which is a deformation of the optic nerve head, which is called papilla, which becomes excavated or hollowed out, which is a pathognomic feature of glaucoma. Another key sign, visual field alterations, which is often detected through visual field testing with a characteristic pattern and progression. Thirdly, chronic ocular hypertension. An elevated intraocular pressure is a major factor in glaucoma development, although some patients may develop a glaucoma with normal pressure level. And finally, an open and microscopically normal iridocorneal angle. This means that the angle between the iris and the cornea, where the aqueous humor drains, remains clear and without visible abnormalities upon examination. Chronic glaucoma is a disease that can lead to irreversible blindness, unfortunately, if not diagnosed and treated early. Systematic screening is therefore very important, especially for individuals over 14 years old or who are at higher risk. When it comes to pathophysiology, the main primary cause of chronic glaucoma is the elevation of intraocular pressure. It is often due to the progressive degeneration of the trabecular meshwork, a structure located in the iridocorneal angle responsible for draining the aqueous humor from the eye. When the trabecular meshwork loses its efficiency in maintaining normal aqueous humor outflow, fluids accumulates, leading to an increased intraocular pressure. Initially, this elevated pressure causes mechanical compression and shearing of the optic nerve fibers. When these fibers are compressed, their function is disrupted, leading to reduced blood perfusion to the optic nerve head, which may result in ischemia or a lack of blood supply. These gradually damages the nerve fibers and can ultimately lead to vision loss, unfortunately. In addition to elevated intraocular pressure, several other risk factors contribute to the development of chronic glaucoma, including hypertension and hypotension. Blood pressure abnormalities can affect ocular circulation, leading to impaired perfusion of the optic nerve. Diabetes. This condition can promote vascular damage and increase the risk of optic nerve impairment. Prolonged use of corticosteroids, especially in the form of eye drop. Corticosteroids can elevate intraocular pressure, particularly in individuals predisposed to glaucoma. Aging. The risk of developing glaucoma increases with age, making systematic screening essential from the age of 40. And finally, a family history of glaucoma. Having close relatives with glaucoma is a significant risk factor. We will talk about the clinical symptoms, positive diagnosis, and treatment for this disease in the following videos. If you have any questions, please leave them below, and I'll see you in the next one. Thank you so much for watching until the end.